Surgeon reveals. Do this one exercise for poor leg circulation. After 70, senior health tips. When the afternoon arrives and your legs begin to feel heavy, swollen, or unusually tired, particularly as you approach or pass the age of 70, it is a common assumption that these sensations are simply an unavoidable part of the aging process. Many individuals accept poor circulation as an inevitable consequence of getting older, much like the appearance of gray hair or the slower pace of mornings that gradually become a new normal. However, what often comes as a considerable surprise to older patients when a compassionate surgeon takes the time to explain it in clear, understandable language is that this doesn't have to be their reality. In numerous cases, the underlying issue is not solely your heart, nor is it exclusively your arteries. Instead, the root of the problem frequently lies with a small yet crucial group of muscles located in your lower legs. Muscles that have, over time and often without conscious notice, quietly ceased performing their vital function. For decades, a fundamental orthopedic and vascular principle has been a cornerstone of medical training and discussion. Your calf muscles effectively operate as a second heart for your legs. This powerful analogy highlights their indispensable role. With every rhythmic contraction, these muscles actively assist in propelling deoxygenated blood back upward toward your heart, working diligently against the persistent force of gravity. When these critical muscles become weakened or inactive, blood tends to pool around the ankles and in the lower legs, leading to the familiar symptoms of swelling, aching discomfort, and that pervasive heavy feeling that often manifest together and significantly impact daily comfort and mobility. A compelling study meticulously published in the esteemed Journal of Applied Physiology in 2021 provided robust scientific evidence supporting this principle. Researchers carefully tracked a group of older adults who were experiencing mild circulation problems and discovered that targeted activation of the calf muscles led to a significant and measurable improvement in venous blood return over a relatively short period of just a few weeks. It's crucial to note that the participants in this study were not engaging in strenuous running or demanding high-intensity workouts. Their regimen involved performing one remarkably simple movement, a movement so unassuming that most people tend to overlook its potential impact, precisely because it appears too easy to genuinely matter. This isn't to say that walking is detrimental. On the contrary, walking remains an excellent activity for promoting overall health and well-being. Nevertheless, walking alone does not always provide these specific muscles with the distinct, clear signal they require to activate effectively, particularly once individuals reach or surpass the age of 70. This scientific understanding and clinical observation are precisely why many experienced surgeons quietly yet consistently recommend integrating one very specific and gentle exercise into a daily routine to actively support leg circulation and significantly reduce daily discomfort. In the remainder of this comprehensive guide, we will meticulously walk you through that single transformative exercise, beginning with a gentle and safe approach, mirroring precisely how it is often introduced and taught to older adults to ensure maximum benefit and safety. If you stay with us through these carefully designed steps, you will gain a profound understanding of why this one seemingly simple movement possesses the remarkable potential to make your legs feel dramatically lighter and considerably more comfortable once again, all without the need for any special equipment and entirely free from undue strain. Before we embark on this enlightening journey, we invite you to share your age and your current location with us in the comments, fostering a sense of community and connection. And as a gentle reminder, please consider liking, sharing, and subscribing to this content, helping to ensure that this invaluable information reaches an even wider audience of seniors who can greatly benefit from it. The journey to improved leg circulation and comfort often begins with a foundational movement, sometimes referred to as gentle seated calf activation. This particular exercise is the cornerstone that many surgeons introduce when an older patient describes the all too common complaints of heavy legs, noticeable ankle swelling, or that persistent, weary sensation that settles in by the end of the day. Its deceptive simplicity is often its greatest obstacle to recognition. It looks almost too easy, leading most individuals to dismiss its potential significance. Yet this seemingly small and unassuming movement precisely targets a critical muscle system that plays an absolutely vital role in maintaining optimal leg circulation, especially as we age beyond 70. This exercise is designed to be performed while comfortably seated in a sturdy chair with both feet resting flat on the floor. There is no requirement for standing, no inherent balance challenge to navigate, and critically, no strain is placed on your knees or hips, making it accessible to a wide range of individuals regardless of their current mobility levels. The action itself involves gently and deliberately lifting your heels away from the floor while consistently ensuring that the balls of your feet and your toes remain firmly grounded. As you execute this movement, your calf muscles engage in a controlled cycle of tightening and relaxing. These muscles are frequently referred to as the venous pump of the legs, a descriptor that perfectly encapsulates their function because their rhythmic contraction is what actively helps to propel venous blood upward, directly counteracting the pull of gravity. In the context of daily life, the effective functioning of this venous pump is far more critical than most people generally realize. When the calf muscles are weak, underused, or largely inactive for extended periods, blood can begin to pool in the lower legs. This pooling effect is a primary contributor to the uncomfortable swelling, the distinct feeling of pressure, the persistent aching, and the pervasive heavy sensation that so many seniors frequently describe. By consistently strengthening and reactivating these vital muscles, you are actively supporting robust circulation, which is particularly beneficial during prolonged periods of sitting, whether you are working at a desk, enjoying television, or traveling in a car. The aforementioned study, published in the Journal of Applied Physiology, comprehensively observed older adults with mild circulation problems and conclusively demonstrated that targeted calf muscle activation led to significant improvements in venous blood return over several weeks. Importantly, the participants were not engaging in intense or strenuous exercise. Rather, they were consistently performing simple, seated movements that sent a clear and unmistakable signal to the muscles, specifically responsible for assisting efficient blood flow. To practice this gentle yet highly effective exercise safely and optimally, begin by sitting tall and upright in a sturdy chair, ensuring your posture is aligned and comfortable. Place both feet flat on the floor, positioned approximately hip-width apart, providing a stable base. From this starting position, slowly and deliberately lift your heels as high as you comfortably can, always keeping your toes and the balls of your feet firmly on the ground. Once you reach the peak of your lift, pause briefly for a moment, truly feeling the gentle engagement in your calf muscles. Then, with the same measured control, lower your heels smoothly back down to the floor. Throughout the entire movement, maintain a slow and controlled pace, and remember to breathe normally and continuously. Avoid holding your breath. If at any point you experience cramping, simply reduce the height of your heel lift or take a short break to allow your muscles to recover. A very common mistake to avoid is rushing through the movement. Speed is emphatically not the objective here. Rather, gentle, controlled repetitions are vastly more effective for enhancing circulation than rapid bouncing motions, which can be less productive and potentially lead to strain. Another critical error is holding your breath, as this can inadvertently diminish the exercise's overall benefit and may even cause you to feel lightheaded. For older adults, mastering this exercise significantly supports comfort, cultivates confidence in their mobility, and reinforces independence. It can be performed daily, even multiple times throughout the day, without inducing fatigue. Many individuals report noticing that their legs feel markedly lighter and less tight within just a few weeks of consistent practice. This gentle activation not only alleviates immediate discomfort, but also meticulously prepares your legs for the next crucial step in our progression, where we begin to thoughtfully introduce elements of stability and strength in a safe, progressively supported manner. Once the calf muscles have begun their gentle awakening and reactivation, the logical next progression involves facilitating even freer blood movement through the crucial joints situated just above them. This brings us to the next recommended movement, the supported ankle to knee flow. This thoughtful and gentle exercise specifically focuses on the synchronized operation of the ankles and knees, working in concert, a collaborative action that is absolutely essential for promoting smoother, more efficient circulation throughout the lower legs as we navigate the natural process of aging. This exercise maintains its accessibility by remaining a seated activity, which inherently keeps it safe, approachable, and manageable for a wide range of individuals. To perform the supported ankle to knee flow, you remain seated comfortably in your chair with your feet flat on the floor. The movement is executed one leg at a time. You slowly and deliberately slide your foot backward toward the chair, allowing your knee to bend naturally as it does so. Then, with the same gentle control, you slide your foot forward again until your leg is almost fully straightened. The emphasis here is on a slow, controlled motion, akin to gently guiding the joint through its natural range of movement, rather than forcing or pushing it beyond its comfortable limits. As the knee smoothly bends and straightens, the surrounding muscles subtly contract and relax in a rhythmic fashion, creating a gentle pumping action that actively aids blood in continuing its vital upward journey toward the heart. In the context of daily life, the importance of this gentle knee and ankle movement is particularly significant because many older adults frequently spend extended periods with their knees remaining largely immobile, especially when they are seated. Limited motion in the knee joint can directly contribute to sluggish circulation, and it frequently leads to increased stiffness and localized swelling in the area below the joint. By consciously restoring and encouraging this natural pattern of bending and straightening, you are actively helping to prevent fluid from settling and accumulating in the lower legs, which is a common cause of discomfort. Research, thoughtfully summarized and presented by the esteemed Cleveland Clinic, has consistently demonstrated that gentle, repeated joint movement effectively improves venous return and measurably reduces stiffness in older adults. These benefits are particularly pronounced when such joint movements are combined with the muscle activation practices we've already discussed for the calves below the knee. The absolute key to success with this exercise is not the intensity of the movement, but rather the consistency of regular, comfortable motion that actively keeps both the joints and the surrounding soft tissues engaged and active. To practice this supportive flow, begin by sitting upright with good posture. For added security and stability, you can place both hands on the sides of the chair, slowly and deliberately slide one foot back, allowing your knee to bend as far as feels entirely comfortable for you without any strain or pain. Pause briefly at the point of maximum comfortable bend, then smoothly slide the foot forward again until the leg is nearly straight. Once you have completed one repetition, switch to the other leg and repeat the process. Throughout the exercise, maintain normal breathing and strive to keep the movement fluid and unhurried. If you ever experience any discomfort in your knee, simply reduce the range of motion and focus on a smaller, pain-free movement. A very common mistake is attempting to push the knee too far or to move too quickly through the exercise. This exercise should unequivocally feel soothing and restorative, not challenging or strenuous. It's helpful to conceptualize it as gently oiling a hinge to ensure its smooth operation, rather than aggressively testing its structural strength. For seniors, this consistent movement profoundly supports overall comfort and cultivates greater confidence when performing daily activities such as standing up, walking, or navigating stairs. It cleverly builds upon the foundational circulation benefits established by the first exercise, and progressively prepares your legs for the subsequent stage, where the crucial elements of balance and stability begin to assume a more significant and integrated role in your movement repertoire. Having gently encouraged circulation through the vital calf muscles, the intricate ankle joints, and the supportive knee joints, the next logical and empowering step in our journey is to help your legs confidently relearn how to manage and distribute your body weight safely and effectively. This introduces us to the HACH supported standing weight shift, a movement designed to reintroduce standing in a carefully controlled and gradual manner without ever pushing your balance or strength beyond what feels genuinely comfortable and secure. For this profoundly beneficial exercise, you should position yourself behind a sturdy, stable chair or near a solid kitchen counter, ensuring your hands can lightly rest on this support for continuous reassurance and assistance. Your feet should remain positioned approximately hip-width apart, providing a stable and balanced foundation. The movement itself involves slowly and subtly shifting your body weight slightly onto one leg, feeling the gentle distribution of pressure through that foot, then calmly returning your weight back toward the center and subsequently shifting it just as gently toward the other leg. The entire movement is designed to be subtle, calm, and deliberate. The objective is emphatically not to lift your feet off the ground or to rigorously test how long you can maintain an unsupported balance. Instead, you are thoughtfully and patiently teaching your legs and hips to collaborate and share the load of your body weight smoothly and efficiently. In the context of everyday life, this inherent ability to gracefully shift your weight is absolutely essential for fluid and confident movement. Every single step you take, every time you turn your body, or even when you simply adjust your stance, your body must adeptly transfer weight from one leg to the other. When this fundamental process becomes hesitant, uneven, or uncertain, circulation can inevitably slow down, and the risk of experiencing stiffness or discomfort significantly increases, particularly after prolonged periods of sitting or inactivity. Authoritative guidance from the renowned Mayo Clinic consistently emphasizes that supported standing movements are highly effective in improving lower limb circulation and enhancing neuromuscular coordination in older adults, especially in situations where confidence and balance may have diminished over time. These gentle and rhythmic weight shifts help the leg muscles to contract and relax in a coordinated fashion, actively encouraging healthy blood flow without imposing the undue strain typically associated with more intense, full-fledged exercise routines. To practice this supportive weight shift, stand tall with your chest relaxed, your shoulders gently lowered, and your gaze directed forward, maintaining a steady point of focus. Slowly and consciously shift your body weight slightly to the right, taking a moment to truly feel the increasing pressure distributing through the sole of your right foot. Then, with controlled movement, return your weight smoothly back to the center position. Following this, shift your weight just as subtly to the left, and again, return to the center. Maintain a slow and steady pace throughout the movement, and remember to breathe naturally and continuously. Avoid any tendency to hold your breath. If, at any point, you begin to feel unsteady or less secure, simply reduce the magnitude of your weight shift or increase the amount of weight you lean through your hands onto the supporting surface. A very common mistake that some individuals make is locking their knees rigidly or leaning their upper body too far to one side. The overarching goal here is quiet, controlled movement, not to achieve a wide range of motion or high speed. It's helpful to envision your body weight moving like a gentle pendulum, swinging smoothly and predictably from side to side. For older adults, this exercise profoundly supports the improvement of balance, enhances circulation throughout the lower limbs, and significantly boosts confidence while standing. It thoughtfully builds upon the foundational benefits established by the earlier seated movements and, actively helps your legs to become more adept and ready for the more functional, real-life movements that await in the next progressive step of our comprehensive circulation enhancement program. Following the gentle reactivation of your legs and the careful reintroduction of balance, the next pivotal step in our progressive journey involves strengthening circulation through a movement that bears a remarkably close resemblance to the actions we perform in everyday life. This brings us to the chair-assisted sit-to-stand exercise, which specifically focuses on the controlled and deliberate act of standing up from a chair. This seemingly simple action is, in fact, one of the most fundamentally important movements for cultivating both robust leg strength and promoting healthy blood flow, particularly for individuals aged 70 and beyond. This highly functional movement begins with you comfortably seated in a sturdy chair, ensuring your feet are placed flat on the floor, positioned slightly behind your knees. From this starting position, you initiate the movement by leaning your torso forward, just enough to effectively bring your body weight over your feet, preparing for the upward transition. Then, with calm and deliberate control, you slowly rise to a full standing position. Once you are standing upright, pause briefly, allowing your body to stabilize and experience the sensation of full weight bearing. Subsequently, you carefully and with the same calm control, lower yourself back down into the chair. Throughout this entire sequence, your hands can be utilized for additional support, either by resting them gently on the armrests of the chair or by placing them on your thighs as needed. In the rhythm of daily life, the act of standing up from a chair occurs dozens of times each day, often without conscious thought. Each instance you perform this movement, a large coordinated group of muscles, including those in your thighs, hips, and calves, contract in unison. This synchronized contraction is remarkably powerful for supporting healthy circulation because it actively pushes deoxygenated blood upward through the legs, while simultaneously building crucial functional strength that directly translates to greater independence in daily activities. When this essential movement becomes difficult or challenging, individuals often instinctively begin to avoid it, which, unfortunately, can create a negative feedback loop that exacerbates both muscle weakness and pre-existing circulation problems. Insightful information shared by the Harvard Health Publishing clearly explains that sit-to-stand movements, when performed slowly and consistently, significantly improve lower body muscle activation and provide vital support for venous blood flow in older adults. The primary emphasis here is unequivocally on control and quality of movement, rather than on speed, a consideration that is particularly pertinent for those who may have concerns about their joints. To practice this exercise safely and derive maximum benefit, begin with just a few repetitions, allowing your body to adjust to the movement. The key is to stand up slowly, taking approximately 3 full seconds to rise to your standing position. Then lower yourself back down into the chair even more slowly, perhaps aiming for 5 seconds or more, truly controlling the descent. Maintain normal, continuous breathing throughout the entire exercise, consciously avoiding any tendency to hold your breath. If you experience any discomfort in your knees, simply reduce the depth of your descent or make greater use of your hands for support, continuing until your leg strength gradually improves. A very common and counterproductive mistake is to drop quickly or abruptly back into the chair. This rapid descent negates much of the valuable muscle engagement and can place undue strain on your joints. By moving slowly and deliberately, you keep the muscles engaged for a longer duration, which is far more beneficial for optimizing circulation and building genuine confidence in your functional strength. For seniors, this chair-assisted sit-to-stand exercise is a powerful tool that actively supports independence, significantly reduces reliance on external assistance, and helps your legs to feel more active and robust throughout the day. It systematically prepares your body for the final and arguably most impactful exercise, where the synergistic elements of circulation, strength, and integrated daily movement converge in the most meaningful and comprehensive way. We now arrive at what many clinicians quietly consider to be the single most valuable exercise for optimizing leg circulation, specifically after the age of 70, the controlled heel-to-stand flow. This exercise is not esteemed for its difficulty, but rather for its profound effectiveness, as it ingeniously combines everything your legs critically need to function optimally in daily life. It masterfully brings together targeted calf activation, efficient weight transfer, and essential standing strength into one seamless, practical, and highly functional movement. This holistic exercise commences from a standing position, with your hands gently resting on a chair or counter for continuous support and unwavering safety. Your feet should be positioned approximately hip-width apart, providing a stable and balanced base. You begin the flow by slowly and deliberately lifting your heels just a little off the ground, consciously feeling the engagement and gentle contraction in your calf muscles. After a brief hold, you then gently lower your heels back down to the floor with control. From this foundational calf activation, you then smoothly transition into bending your knees slightly and then straightening them again, creating a motion that feels as if you are beginning to sit down, but crucially, choosing to stand tall and upright instead. The entire movement is designed to flow calmly and continuously from the initial heel lift through the gentle knee bend and then back to a fully relaxed yet engaged standing position. In the intricate dance of everyday life, this precise pattern of movement is of incredible importance and utility. Consider the actions involved when you rise from a chair, take a confident step forward, or simply adjust your stance. In all these scenarios, your calves, thighs, and hips must work together in a coordinated and harmonious fashion. This synchronized action is a powerful mechanism that actively helps to push deoxygenated blood upward through the legs, while simultaneously reinforcing the critical strength and stability needed to maintain independence and confident mobility. Many common circulation problems often worsen simply because these vital muscle groups cease to work together efficiently and effectively. Authoritative guidance from the National Institutes of Health consistently highlights that combined lower body muscle activation, as opposed to isolated movements, significantly improves venous return and enhances functional mobility in older adults with greater efficacy. When multiple leg muscles contract in a controlled and deliberate sequence, the support provided for circulation becomes markedly stronger, more consistent, and more enduring throughout the day, translating into sustained comfort and vitality. To practice this profoundly beneficial controlled heel-to-stand flow, begin by standing tall and relaxed, yet engaged. Slowly lift your heels, feeling the gentle work in your calves. Pause briefly at the top of the lift, then smoothly lower them back down. Next, bend your knees just a little, a comfortable flexion, and then straighten them again. The paramount objective is to maintain a smooth, unhurried, and continuous movement, always remembering to breathe naturally and deeply throughout the sequence. It is advisable to start with a small range of motion and only increase the depth of the knee bend or the height of the heel lift if it feels entirely comfortable and secure. If you ever perceive any unsteadiness, prioritize your safety by relying more heavily on your hands for support or by reducing the depth of your knee bend. A common pitfall to avoid is rushing through the movement or mistakenly transforming this into a vigorous squat. This exercise is fundamentally not about pushing yourself to your physical limits. Rather, it is about cultivating steady, confident, and harmonious movement that your body readily recognizes, adapts to, and can comfortably repeat on a daily basis. For older adults, this comprehensive exercise simultaneously supports robust circulation, enhances critical balance, and strengthens the foundation of independence, all within a single, integrated movement. If you were faced with the decision to choose only one movement to help your legs feel dramatically lighter, stronger, and more comfortable after the age of 70, this is unequivocally the exercise that many seasoned professionals would recommend integrating into your regular routine. It naturally and seamlessly leads us into our concluding message, which underscores the enduring importance of maintaining comfort, cultivating unwavering confidence, and preserving invaluable mobility throughout your later years. Over the last few insightful minutes, we have explored how optimizing leg circulation after the age of 70 does not necessitate pushing harder or engaging in overly complicated, strenuous workouts. Instead, it commences with the gentle yet deliberate process of awakening the muscles that are specifically designed to assist blood movement throughout your lower limbs. We then progressively move towards slowly restoring natural motion through the often neglected joints, learning to confidently and evenly share your body weight, and ultimately bringing all these integrated elements together in a calm, practical, and highly effective standing movement. Each thoughtfully designed step in this progressive sequence meticulously builds upon the one before it, aligning perfectly with the body's innate preference for gradual adaptation and harmonious integration. When these specific movements are practiced consistently, day after day, week after week, a remarkable transformation is often observed. Many older adults notice that their legs feel dramatically lighter, significantly less tight, and far more reliable in their daily function. The simple act of standing up becomes notably easier, sitting for prolonged periods feels considerably less uncomfortable, and walking is approached with a newfound sense of confidence and security. This profound improvement is not achieved through aggressive force or strain on your body, but rather because you have gently, yet effectively, reminded it how to work efficiently and harmoniously as a cohesive whole once again. Crucially, improved circulation manifests not through sheer intensity of effort, but through clarity of movement, thoughtful consistency, and diligent repetition. The long-term benefits extending from these practices reach far beyond mere physical comfort. Actively supporting healthy leg circulation plays a pivotal role in protecting and enhancing your balance, significantly reducing the often debilitating fear of falling and preserving your invaluable ability to move independently through life. These are not minor considerations. They are, in fact, the fundamental pillars that empower you to remain active and self-sufficient in your own home, to fully savor cherished moments with family and friends, and to navigate the intricacies of daily life without the constant underlying worry of your legs impeding your progress or holding you back. Aging, in this context, does not equate to surrendering control over your physical well-being. On the contrary, it signifies making empowering choices about movements that profoundly respect where your body is today, while simultaneously encouraging its incredible capacity to adapt, strengthen, and thrive. Small, thoughtful, and consistent practices such as these possess the quiet yet immense power to support your health, vitality, and independence for many fulfilling years to come. Now, we would genuinely love to hear from you. Which specific aspect of leg discomfort affects you the most right now? Is it heaviness, noticeable swelling, or pervasive fatigue? Please take a moment to leave a comment below, sharing your age and where you are watching from, contributing to a collective understanding. If you found this video to be helpful and informative, please consider liking it, sharing it with someone in your life who might benefit from this guidance, and subscribing for more expert advice and supportive information designed specifically for the unique needs and well-being of older adults.